Hello, I'm Dr. Valerie Walker, and welcome to another episode of the Medical Minute. Well, we have a kind of challenging thing we're going to talk about today, and the name of this show is Your Breath Stinks. Yes, I said it. Your breath stinks. And this is called halitosis. You can look it up anywhere, but your breath stinks. And for some reason, I am capturing more bad breath than I have since I've been a doctor. And a lot of that has to do with the mask that we're using. And I don't care if you got on a fancy mask like this one. I don't care if you just got the regular mask. I don't care if you got the N95 on. Your breath stinks, and especially with these masks, because you're breathing in oxygen, you're breathing out carbon dioxide, so all that air is bouncing back on you, and it leads to bad breath. So even with the mask, you can even have on the plain ones, you can have on the N95 ones, it does not matter because of the way we breathing and all this air getting bounced back on our face and stuff, it can cause some bad breath too. So if you're like Taco Bell and everybody coming up on you and they're running from the border, or like the police, remember the police tell you to stand or step away from the vehicle? When you walk up on people, is everybody kind of stepping away from you? Well, the problem may be that you have bad breath. Now, let's talk about bad breath and why it's so bad to you. Did you know that halitosis, or bad breath, or not taking care of your teeth, is linked to cancer and heart disease? Yes, it is. So it's a very good reason why we want to keep everything that comes into the system, which is through your mouth, everything that enters, food, drink, everything come in through your mouth, all the way down to where it comes out at, in your rectum. And we talked about keeping your rectum clean. So that's why today we're going to talk about how to keep your mouth clean. And the number one thing you want to do to keep your mouth clean, number one on the list, is have what we call proper dental hygiene. You have got to take care of your mouth. You have got to take care of your teeth. And what we describe as the twos is, number one, you've got to brush your teeth at least 2 times a day. I brush mine at least 3 because everybody always talk about, oh, Dr. Walker, you got them big hunky white teeth. Well, because I brush at least 3 times a day, but you don't have to. At least make sure you brush your teeth at least 2 times a day. The rule of 2, so that's 2. Number 2, the 2 is make sure you see your dentist at least 2 times a year. This is all part of keeping good dental hygiene. And number 3, you want to brush your teeth at least 2 minutes. Don't go in the bathroom and do this. This is the way most of you brush your teeth. And then you out of there. Oh, no. Put a little timer there. If you need to remember that you need to stay in there and brush your teeth at least 2 minutes every single time you go in, then that's what you got to do. And the other 2 is that you have got to floss your teeth. And when you use your toothpaste, make sure it's a fluoride toothpaste. That helps with the cavities and all. And when you floss, a lot of times you can't floss 3 times a day, but for sure you can floss at least 2 times a day, preferably after a meal. Because just imagine, if you don't floss your teeth, and most of our teeth are a little tight together, all that food that gets trapped up in your teeth and along your gum line, it mixes with bacteria and causes what we call periodontal disease. Can you imagine a piece of chicken that's been stuck in your mouth between your teeth for a year? Oh my God, I don't even want to think about it, and you don't either. So you want to get that excess food out, and you want to floss it. So those are our rules of twos is you got to brush, at least see the dentist twice a year, you got to brush at least 2 minutes, and you have got to floss. So that's number 1 on the list to prevent halitosis and stop people from running from you. I've had patients tell me that they have friends whose breath is so bad they can't even stand up close to them, or when they do, they're holding their breath till they turning blue, purple, and green in the face because their breath is just so bad. And a lot of times patients' breath be so bad for so long, they don't even smell it. You know, they can't even smell that their breath is like that until they like in a closed car or something with a lot of people, and you're going to notice the person kind of gently reach over and let the window down in the car, and then they let it back up again. They try to get some fresh air in there because your breath is doing what my grandmama said. Your breath is cutting up. So you've got to keep your mouth clean. So what goes in and has to come out, you got to keep it clean. Now the other thing that keeps our breath smelling bad is our diet. It's what we eat. And I'm not just talking about onions and garlic and scaring Dracula away. I'm not talking about that. I'm talking about foods that are high in carbohydrates and sugar. That sugar mixes with the bacteria in your mouth and cause a lot of problems with plaque and plaque buildup, and that in turn causes your breath to smell bad. So you want to pay very good attention to your diet. The best diet are things that are crunchy, like celery is crunchy, an apple is crunchy, and I say in my book, if it's good, spit it out. And the good things are usually soft. That's not good for the teeth. Ice cream, pudding, cakes, pies, dressing, macaroni and cheese, all the soft things are usually not good, but hard and crunchy like celery and apple is very good for you. So your diet plays a very, very big role in your dental health. The other thing that damages your teeth is alcohol. Yeah, alcohol can eat at the enamel on your teeth that keeps your teeth nice and strong, and alcohol can just lead to all other problems that we talked about earlier in one of our shows, where it can cause erosion in the mouth and all, especially if you're drinking hard liquor. You ever notice people that drink a lot for a long period of time, the bottom part of their lip is real pale and ate out? That's because over the years, all that alcohol has burnt out the pigment in their lower lip, and you can tell that they've been drinking a lot and for a long time. So watch the alcohol, because it can give you bad breath also. Smoking can give you really bad breath. And heaven forbid if you smoke in the morning and then you wake up in the morning with morning breath and turn over to your spouse trying to look sexy. Oh no, you're not looking sexy, not at all. You're looking terrible, and your breath is the morning breath is the worst breath of all. You doing this, you got to immediately go in that bathroom and you have got to brush your teeth, because overnight, this is the problem, all that bacteria and food that you left in your mouth because one, you didn't brush your bedtime, two, you didn't floss to get all that dead food out from between your teeth, has mixed with that bacteria. So those of you who can wake up in the morning and get romantic and all, I salute you. But for those that can't, you need to go in the bathroom and you need to brush your teeth first thing in the morning, and try not to swallow all that goop that has built up overnight, because there again we associate cancer and heart disease with poor, or what we call, oral hygiene. Other things, there are diseases that can cause you to have bad breath. Acid reflux, GERD as we call it, because it's a process goes on in the body, in the stomach, where sulfur is released into the body, and sulfur has a strong kind of pungent odor. So if you notice somebody who you say, oh, your mouth smell like and your breath smell like rotten eggs, chances are that person has acid reflux and GERD, and that's where it's coming from, is from that sulfur release. Sinusitis, people who have problems with their sinus, and you draining all this yucky, nasty, greens, brown stuff down your throat, that's full of bacteria. It can make your breath smell horrible. A lot of times I can diagnose a sinus infection just when the patient start talking, because I can smell their breath. Where I grew up in Georgia, we didn't have all these problems with chronic sinusitis like I experienced when I moved to St. Louis to Missouri, because I guess the air and the quality and all was just a little bit clearer. And one of the other things that can make your breath smell bad or give it a different type of smell is actually diabetes. People have diabetes whose sugar's way out of control and suffering with this thing we call ketoacidosis, because the body is making all these ketones in response to the sugar being real high. Has a kind of sweet, fruity scent to it. So don't forget diabetes. You're going to hear diabetes mentioned in a lot of things too. It's really, I think diabetes is just a multitude of systemic diseases that just takes over the human body. Another thing is if you're having problems like with a bowel obstruction, you know if the obstruction gets so bad, and I'm not trying to be graphic, if you eat and poop can start backing up, not going to your bowel, the way food digests is from the mouth and all the way down through the rectum. But a lot of times with a severe bowel obstruction, you can actually have your breath smelling putrid like poop, and that's a way you know you need to try to see the doctor. Also kidney disease, because the kidneys are charged with filtering the blood and getting all the toxins and poisons out of the body. A lot of times people with kidney disease can have problems with their breath. So those are some of the things that can give you bad breath and smelly breath. But let's talk about what we're going to do about it. You know, we always going to give you an answer what you need to do. And what you're going to do is what we call my rule of two. Just remember, two. You'll remember nothing else. Remember two. You're going to be so smart watching all these series. The first two is you've got to brush your teeth 2 times a day, at least. You can do it more than that, but at least 2 times a day, especially at breath time. You want to make sure you floss your teeth every day, especially after meals. Can you imagine all that old food caught up in your teeth for months? Oh my God, I couldn't even imagine the smell it could have. So you want to get all that old dead food out of your teeth because the bacteria in your mouth mixed with that food, and it's responsible for a lot of like what we call periodontal disease and gingivitis and all the bad things that happen because all that crap food is in your mouth. Imagine crap food been in the kitchen for a long time, how bad it gets to smell. That's 2. And then the other 2 is that you want to brush at least 2 minutes. That's 2 minutes. Don't and then you're done. No ma'am, no sir. You got to brush at least 2 minutes and probably use a toothpaste that has fluoride in it. So you want to brush twice a day. You want to floss twice a day. You want to use your toothpaste with some fluoride in it, and you want to visit your dentist at least twice a year. And those are my rules of two. If you do this, visit that dentist. Don't be scared to go to the dentist. I have a dentist, her motto is Dr. Nubio, and she caters to college. And she does. If you're scared, she's your dentist. She does a fabulous job. So you're going to see the dentist, brush twice a day, floss, and make sure you need to use a fluoridated toothpaste, and you should come out with fresh, smelling, clean breath, and make sure you don't have any of those diseases that we talked about going on. This has been Dr. Valerie Walker, and yes, your breath stinks, but 2, you just did something about it. I'll see you next time in Medical Minute.